In the Blitz bombings of World War II in Britain, the Women's Volunteer Service for Civil Defense began bringing home-cooked meals to servicemen and civilians whose homes had been destroyed. Within the confines of a conflict zone, the women had to stretch their resourcefulness past any limit and carried the meals around in baby carriages, originating the term Meals on Wheels. In 1954, a group of visiting British students recognized the similarity between Margaret Toy's platter angels, who brought food to homebound individuals during a particularly harsh Philadelphia winter, and the volunteer women from their homeland, and transferred the nickname to the United States' version, where it has become permanently attached to the programs. After the Platter Angels, similar Meals on Wheels programs sprang up around the country, often funded by a combination of donations and small fees from those who could afford it. A paradigm shift came in 1965 when the Older Americans Act first provided funding to support older adults through federal dollars. Although the act only initially supported congregate meal services, support for home-delivered meals was added in the late 70s, and by 2019, the federal government spent over $250 million on home-delivered meals. Meal delivery services today are a far cry from those baby carriages and have further expanded in popularity beyond their traditional client base. In addition to the traditional Meals on Wheels setup, commercial services have expanded to offer convenient meal deliveries to a broader consumer base. Meals on are offered as either a fresh daily delivery or a weekly frozen drop-off. With so much innovation in the field, we examined another possible shift, building a delivery service for Medicare Advantage enrollees based in local, sustainable practices. Traditionally, a Meals on Wheels styled service would assemble ingredients at a central location, then deliver freshly made meals to a client's home. Our proposed service would follow the same model, preserving all of the best effects of Meals on Wheels, but adding another element, the locally sourced ingredients. The benefits of delivering meals to homebound seniors have been extensively studied. Select studies have shown that clients increase their caloric intake, protein intake, and the healthiness index of their meals. Other studies have shown a decrease in the number of hospital admissions, decrease in the proportion of nursing home residents who need low-value care, and a potentially decreased risk of falls. Together, these outcomes result in lower costs to the healthcare system. And further, daily deliveries connect drivers with clients to provide both socialization and an informal safety check. The benefits of local food have been less studied, but research suggests that locally sourcing food decreases the time from harvest to consumption, decreases the carbon footprint of food by reducing the distance traveled, and stimulates local economies by increasing the proportion of pay that returns to farmers. Already, local providers and meal delivery services exist. To spur innovation, we must bridge the gap between those two and shift the way meal deliveries are offered. Thank you.